China says it is reversing a controversial policy of separating babies and young children from their parents if they test positive for COVID-19. An official in Shanghai announced Wednesday that parents will be allowed to stay with infected kids in mass quarantine centers, even if they were not infected with the virus themselves. The city's lockdown is now in its second week and covers the entire population of more than 25 million people. China has been seeing its worst COVID outbreak in more than 2 years. Lawrence Gostin is a university professor at Georgetown University. He is also a director for the World Health Organization Collaborating Center on National and Global Health Law. Lawrence, thanks for joining us. Shanghai is the largest single city to be locked down to date. Tens of thousands of people are being quarantined at these designated isolation facilities. What human rights issues do these strict COVID protocols bring up?
I think they're massive, Elaine. There is a shortage of food, medicines. They're warehoused in large quarantine centers. People aren't allowed to be in their homes to isolate the way we would in the United States. And, China had to crawl down from a policy of actually separating mothers and babies. And, I've seen photographs on social media in China of horrendous conditions for those babies where there aren't enough nurses to change their diapers.
Wow. And of course, it's difficult to really get a true sense of what is happening from the government. We're not getting any kind of information coming out of there. There are also reports of workers at banks, investment firms, and other businesses in Shanghai being asked to stay in their offices for days or weeks at a time. What do you make of this hardline approach to ensure continuity of business? And how much does this have to do with China's global image?
I think it has everything to do with its global image. The truth is that China's COVID zero strategy can't possibly work. The Omicron variant, and particularly the subvariant BA2, is the most infectious pathogen on the planet. And sooner or later, most people in China are going to get sick. And these massive denials of civil liberties, the intrusive surveillance, the separation of families, the overcrowded, unsanitary conditions, it's entirely unjustified. And frankly, it's because Xi Jinping is hoping to be elected pretty much for life in the fall in the Chinese Communist Party meeting. And I think that's really what this is all about.
So, Lawrence, give us some context here. So China is seeing the most severe coronavirus outbreak since the initial lockdown in Wuhan at the start of 2020. What did the country do to control the spread of the virus before, and why is it not working now?
Well, it worked before, and we have to, take our hats off to them. They were one of the most successful countries during the first 2 years of the pandemic, using very, very aggressive testing, contact tracing, and isolation and quarantine procedures, and also selective targeted lockdowns in neighborhoods, in housing complexes and things like that. What's changed is the virus itself. This is a virus now that has no comparison in terms of its infectiousness. And it's aerosolized, people can breathe it in. And it's really a fool's errand to believe that you can prevent this virus from spreading. Ironically, China is in one of the worst positions in the world right now because their population is pretty much naive to infection. That is, in the United States, in Europe, and other countries, many, if not most people have already had COVID or had a very effective vaccine. China's not in that fortunate position. Its vaccines aren't as good as the ones in the West, and people haven't gotten COVID. And so it could burn through that population, causing, potentially millions of cases hospitalizations and deaths. It's not a smart strategy 2 years into the pandemic.
Sounds like a potentially dire situation shaping up. Lawrence Gostin. Lawrence, thank you very much for your insight.
Thanks, Elaine.